considering risk for colon polyps, the following points should be considered. Polyps are common. They occur in around 50% of adults. Not all polyps will become cancer. It takes many years for a polyp to become cancerous, and polyps can be completely and safely removed. The best course of action when a polyp is found depends upon the number, type, size, and location of the polyp. People who have an adenoma removed will require a follow-up examination, as new polyps may develop over time that need to be removed. The most common types of polyps are hyperplastic polyps, adenomatous polyps, sessile serrated polyps, and traditional serrated adenomas. Hyperplastic polyps are usually small, located at the end portion of the colon, have no potential to become malignant, and are not worrisome. Adenomatous polyps, on the other hand, account for 2/3 of the colon polyps. Most of these polyps do not develop to cancer, although they have the potential to become cancerous. Adenomatous polyps are classified by their size, general appearance, and specific features as seen under a microscope. As a general rule, the larger the adenoma, the more likely it is to eventually become cancer. Sessile serrated polyps and traditional serrated adenomas have the potential to develop into cancer. They are usually removed completely to prevent cancer. Malignant polyps, however, contain cancerous cells. The optimal treatment for malignant polyps depends upon the extent of the cancer. This is determined when examined under a microscope and other individual factors. How do you remove a colon polyp? Colorectal cancer is preventable if precancerous polyps, i.e. adenomas, are detected and removed before they become malignant or cancerous. Over time, small polyps can change their structure and become cancerous. Polyps are usually removed when they are found on a colonoscopy, which reduces the chance for the polyp to become cancerous. The medical term for removing polyps is termed polypectomy. The polyps are usually removed by placing a snare around the polyp base and cutting off the polyp. Polyp removal is not painful because the lining of the colon does not have the ability to feel pain. In addition, a sedative medication given during the colonoscopy will prevent any pain caused by stretching of the colon. Rarely a polyp will be too large to remove during a colonoscopy. In this case, a surgical procedure will be needed at a later time. What do you do after a polyp is removed? The results of the tissue analysis of polyps are discussed with the patients when they are available. This usually takes a few weeks after the procedure, and then to decide if and when a follow-up examination is needed. People with adenomatous polyps have an increased risk of developing more polyps. There's a 25% chance that the risk of adenomas would be present on a repeat colonoscopy done 3 years after the initial polypectomy. Some of these polyps might have been seen or have been really small during the original examination, and other new polyps may also have developed. The exact time interval for follow-up varies depending on several factors. One, the microscopic appearance of the polyp, the number and the size of the polyps, and whether it was possible to examine the entire colon, because a bowel preparation is needed before a colonoscopy to remove all traces of stool in the bowel. And during this bowel preparation, if it was not adequate enough, stool may remain in the colon, making it more difficult to see small to moderate sized polyps. In such situations, when the colonoscopy was not adequate, it should be repeated to ensure adequate visualization.